Today we will discuss about thyroid biopsy. What is thyroid biopsy? The thyroid is a gland which is located interior neck and the span at the 6-5 and the T-lab. It is consists of the two lobes which are connected to the internal thymus interiorly. Its shape looks like a butterfly. These lobes of the thyroid gland are wrapped around the cricoid cartilage and the superior ring of the trachea. Superior ring of the trachea, which is very near to the mouth and the visceral compartment of the neck. As we can see the pictures of a thyroid gland, this is a butterfly shaped thyroid gland which is located in the upper part of the trachea at the level of C5 and T1. This is larynx and this one is thyroid gland. Here is a nodule and this is the remaining part of the trachea. Thyroid biopsy. Why we done the thyroid biopsy? An ultrasound guided fine needle aspiration biopsy help to locate the nodule or any other type of abnormality. And the removal of a simple tissue for examination, is it cancerous and non-cancerous? This procedure is very less invasive than the surgical biopsy. Leave little no scar and not involve the ionizing exposure. And the other thing, what we do in biopsy, a fine needle aspiration, if there is a tumor in thyroid, and with a fine needle we took the removal of a small tissue piece of the thyroid gland and go for to check its pathology. During a fine needle aspiration of the thyroid gland, a small tissue is removed from the thyroid gland. The thyroid gland is located in front of the neck, just above the neckline, is shaped like a butterfly, with two lobes on either side of the neck connected by its narrowing. Commonly used, why we commonly use this procedure? If we want to see if it is benign or malignant, if the imaging cannot clear definitely define its abnormality, a biopsy is very necessary. How should we have to prepare for? Please notify your physician if you are taking blood. If anybody is taking blood thickening agents such as aspirin, Levinox, and the Coumadin, you will know special preparation required for this procedure. Sonographic guide offer the advantage of precisely targeting small lesion. Fine needle biopsy long been started technique for the diagnosis. However, it is provided by the pathological diagnose. Patient lay down on the bed and the ultrasound. The probe is hold like the in transverse position, and needle is inserted. A fine needle is inserted to prick the tissue. Ultrasound guided biopsy is based on the principle of the fine needle biopsy technique. The patient is placed in supine position, neck is extended like this. After the skin is prepared, the sterilization drap and 3 to 4 subcutaneous ardicaine, 1% applied for the anesthesia. A 2 mm skin SAN made is 18 gauge injection tube. The biopsy needle is inserted under continuously ultrasound monitor. The needle tip is bored to selected preferring location and the biopsy gun is fired. Precaution what when determining approach, the route and the preferring needle tip position, care should be taken. Avoid the carotid artery. In addition, the needle tip should not pass through the gland. If the needle pass through the thyroid gland, the recurrent nerve, esophagus, trachea, or vertebral artery can be dangerous. These transducers are used for biopsy. Sagittal sonogram of the right thyroid show the 6 mm nodule calcification. This is 6 mm nodule calcification, so the clavicle nodule calcification high echogenic like this.